so we're going to go through today marker placement using the set that we standardly use in the Granada lab. We'll start at the feet and we'll work up to the pelvis. This is a lower extremity set only. We will place bilaterally, as most of what we do looks at side-to-side symmetry. So again, I'll start at the bottom. I'll try and walk through specifically which markers I'm placing as we go. So again, we'll place first and fifth met head. So what you want to do on a shoe like this is feel for the ball on the front side, or on the medial and the lateral side, the inside and the outside of the foot. You want to place the marker on the side of the foot, not on the top, but on the side. That marker placement will be used as we define the longitudinal axis of the foot. And then we'll also place medial and lateral malleolus. Again, you want to make sure you're on the ball of the joint. We're going to place 3 on the rear foot. In a shoe, you want to keep the markers on what's called the heel counter. So if you feel the shoe, you'll feel a kind of a plastic heel-shaped material inside. And what you want to do is to place 1 on the top, 1 on the bottom, again, directly in line with each other, and then 1 on the lateral side. And then we're going to repeat the exact same thing for the other foot. The one that's lateral just needs to be out of the plane with the other 2, so its exact position isn't terribly important. So you go superior, inferior, and then we'll place, if they're not stuck together, there we go, a lateral marker. And then Jill, if you don't mind, face the back wall here for me, and we'll do the exact same things. We'll place medial and lateral malleolus, first and fifth met head, on both feet. So, okay, go ahead and turn back around for me and face that way. So that's kind of your foot marker set, at least for what we typically do in the lab. Once we've done the static standing trial, the first and fifth met head will be removed and the medial malleolus will come off. But for all static trials, you're going to want the entire thing. Okay, I typically now skip past the shank. We'll come back and do that at the end, and the thigh. So I place all my anatomic markers first, and then come back and do the shells. It's just easier for me, but you can do that in any order. So if you'll face me real quick, to find a knee marker, or to find your knee marker position, it's easier for me if I have the markers already in my hands, because once I find them, then I can go ahead and stick the marker on. So what I want you to do is go ahead and bend your knee for me. And what you're feeling for is the opening of the joint space. So it should be about the midway of the patella. So if you find the sort of center of the patella, and what you're looking for is where your fingers kind of dip in. And then I'll have her stand up and bend a few times and just make sure that I'm really on that joint space. And I'm feeling it. Again, with guys, what you'll see is you'll need them to bend just a little bit farther forward, because what you'll want to do is make sure the IT band gets out of the way of that joint space so you can really feel it. All right, go ahead and stand back up. When you place markers, make sure you're placing them with them standing, and make sure their foot is pointed straight ahead. You want the marker to be positioned front to back so that it's in line with your malleolar markers, and eventually with the greater troch marker that you'll put on. Little tidbits to remember as you're working with, especially women, ask them not to wear lotion. It'll help keep your markers on a little bit better. And we'll do the same thing on this side. Go ahead and bend your knee for me. The markers should be relatively even side to side if it's a healthy control. Go ahead and stand back up. If it's a patient, you might find that they're a little bit off from each other. Just make sure you check them and make sure you're on the joint space. If they're off, it probably is what it is for that particular patient. The medial side does tend to sit a little low. To the lateral, that's just the angle of the axis of the knee, and that's okay. All right, now we're going to move up into the pelvis, and we're going to work on placing them on, well, we'll shorten it to the ASIS, but the anterior superior iliac spine. So what you want to feel for first is the top of the pelvis. You should be able to kind of rest your hands on top of it, and then if you follow it down forward, what you're looking for is the bone that sticks out in the front. It should be roughly there. Again, some people, it's really easy. Some people, it's more challenging. If you're working with somebody who's a little bit heavier set, just make sure you push a little bit, tell them what you're doing. before you start doing this, because you are working, in the pelvis. Some people are ticklish, so also be aware of that as you're starting to place markers. Go ahead and flip around for me. Now what we're looking for is, again, if we were doing this for testing, I'd probably have her in a tight-fitting shirt or in a sports bra, depending on what the study is and the comfort level of the participant, so that we're making sure we're right on the skin if we can. And if we can't, then we want it as close to the skin as we can, so on something that's spandex. So we're looking for PSIS, which is the posterior superior iliac spine. Again, depending on the person, this is really easy to find. Some people it's more challenging. So I've already found Jill's, but what I'm going to have her do is bend forward, like she's going to touch her toes. And what you'll find is the PSIS kind of sticks right out. Go ahead and stand back up for me. Again, sometimes with little children, if you're doing this with pediatric patients, there's actually a divot in the lower back that'll show up that you can see. And when you see that, that's right where their PSIS is. Again, typically I wouldn't have a shirt on, so I wouldn't have to keep tucking it in for her. The next one we're going to place is L4, L5, which is the space between the fourth and the fifth lumbar vertebrae. So the easiest way to find that, again, I always keep a marker on my hand. I'm going to place my hands kind of on the shelf of the iliac crest, and then I'm going to bring them together in the center so that it's a level plane. That's going to be L4, L5. It should be right in the center of her back, so right down her spine. And what you should end up with is a triangle that's formed between the PSIS markers and the L4, L5 marker. If it doesn't look like a triangle, you're going to want to go back and redo your palpation and find that spot. All right. The next ones we're going to place are iliac crest. And again, if we were doing this, I would have her in a tighter fitting shirt. But iliac crest, we've already kind of found 3 or 4 times in finding these other markers, but it's just right at the top of the crest of the hip. Again, you want to try and make sure you're on the outside so that you're lining up straight down the leg. So what I'll have Jill do next is face the television, so face forward that way. And we're going to place greater troch. So it's greater trochanter. It's often, the confusion is that people want to place this at the widest part of the hip. That's not necessarily where the greater troch is. What you're wanting to find is the spot where you feel it move back and forth. So what I'll have Jill do here is put your foot forward so your heel is out, and keep your weight back on the foot that's standing. And I just want you to take your foot like this and rotate it back and forth. So what I'm feeling for is a spot in her hip that's rotating. Right? The other way to do this is if you stand up both feet together and just kind of rock side to side this way. Like kind of stick your hip out. There you go. That's the other way to find this. It sticks out to the side, the greater troch will. And again, I want to line up the iliac crest marker with the lateral knee and with the greater troch and the ankle. Now, what you can see with Jill is that she hyperextends her knee a little bit. So if I ask her to stand a little more neutral, so bend your knee a little bit for me, you'll see I'm now in a straight line. You want to make sure that you're aligned when they're straight, not when she's hyperextended, because when you go to process this data, you want to know that she's going into hyperextension. That's the way that her legs are built, and it's okay. So you just might want to look at their alignment when they're standing. You might have to adjust it a little bit. Go ahead and rock out towards me or do heel out, either one, whichever's more comfortable. Okay, go ahead and stand up. Again, always place your markers with them standing straight up. And again, I'm looking for the same thing. She also looks to have a little bit of rotation in her thigh, which is why you're seeing this look a little bit farther forward. Again, you'll get used to that the more you place markers. All right, so the thigh and the shank for us, we use shells so that we have a rigid body, so that we know these 4 markers aren't going to move relative to each other. And what we do is we want to place those on the lateral side, somewhere between the greater troch and the knee. You don't want it to be too low, or what you're going to find is it's just going to slide down. And if you're too high, it's going to be almost impossible to wrap this around. So you kind of going to want to go midway through the thigh. Again, if you're not used to doing this and you've got another person there, 2 people can put this on together. You're going to wrap it on much like you wrap on an ACE wrap. Once you get the first one through, it's a little easier. You want it tight, but not so tight that they can't move. So there's a little bit of communication that has to go between you and the person you're placing them on to say, is that comfortable? Is it too tight? All right. I don't want to cut off circulation. That's important. And again, you're going to keep wrapping, and eventually what will happen is you'll come to the end, and there's a little piece of Velcro. And you just want to Velcro it on. Now, I didn't do that in the best way that I could have because we ended up with the Velcro kind of right between your legs. Ideally, you would like the Velcro somewhere here in the front. I'll see if I do a better job on the other one. Some of that is getting used to how long your elastic wrap is and where you need to start. Again, these don't have to be at the same height side to side because you're using the position of these shells relative to the other markers on the leg as a means of determining rotations of the thigh for these particular markers. All right, is that too tight?
That's perfect.
Okay. Great. Once we get this one on, we'll go ahead and put did a little better with that one. And if you're afraid that they're going to come off, just put a little piece of athletic tape or something over that Velcro and you should be fine. Make sure that you're not covering up any of your markers as you are finishing up. Just make sure that they're nice and they're able to be seen. Nothing worse than getting all the way through a data collection and realizing you couldn't see one of your markers the whole time. So always check that in the camera views when you get to that point. Depending on the type of testing you're doing, you may need to move these shells. Sometimes we will slide them a little bit farther back. Can be challenging if you're doing jumping and landing because you might lose them, or running, which is why I tend to like them a little more on the lateral side. There's less muscle mass here on the side as well, which is why we don't tend to place them right on the front. Same idea here. Again, you don't want to go too low on the shank markers because it will start to slide down. You want it as tight as you can get it, and not so tight that they can't move or contract the calf muscle. Is that all right?
Yep.
Okay. Again, if you don't drop it, should be able to wrap it around. Again, try and avoid fastening it right between the legs, otherwise you run the risk of just kind of getting it popped off when you're doing different things. Okay, we'll do the same thing on the other side. And then we always take one last look and make sure everything looks like it should. And for the most part, I think we're fine. Perfect. Is that too tight?
Nope, that's good.
Okay. Perfect. There we go. All right, so for our standard marker set, this is how somebody should look as you're getting ready to test. You should have all of the markers on the feet, the shells on the shank and the thigh, medial and lateral knee, greater troch, ASIS bilaterally, although I don't love these. And see, this is why we go back and check, because this one is a little high. ASIS, PSIS, and then the L4, L5 marker. After they're done with their static trial, we'll remove, again, the first and the fifth met, the medial ankles, the medial knees, and then depending on the project, we may take off iliac crest. We've started to leave that on a little bit more, just as another marker that's on the pelvis in case we have to recreate anything that falls off during testing.